Guy is HIV or is non-detectable as he's taking his cocktail. Can an effective sexual relationship occur? Can he give me HIV by oral sex? Are you willing to provide a prescription for me for PrEP? How can I get in contact with you?
Let me answer the last question first, because that's the easiest. It would be completely irresponsible of any provider to give a prescription for PrEP without a full medical evaluation. So find a provider who can fully evaluate you, whoever asked that question, and they can determine if PrEP's right for you. That's the easy part. So the other question is the million-dollar question. I know Eric and probably others are going to want to weigh in here. But the question that's sort of on the table is a complicated one, right? You have a serodiscordant couple, which means you have two people. Let's not even call them a couple. You have two people, one's positive, one's not. Okay? They're having sex. And for a minute, let's pretend that it doesn't matter if it's men or women or two men. Okay? Let's just pretend for a second that this is, it's going to come out wrong, all comers. I know, poor choice. Just snorted. Okay.
Mr. Linder snorted.
Now you're blushing. Okay.
Just drawing a recall.
For every sex act, there is a. We science people, we like to get very nerdy and wonky about this, right? We're science nerds. We like to say, so there's a per coital act risk of transmission for every coital act, right? And it's different for receptive anal intercourse. This is so clinical. It's like devolving something that's fun and pleasurable.
Taking it up the butt.
Yeah. Insertive anal intercourse.
Putting it in the butt.
Receptive vaginal intercourse.
I don't know that.
Insertive vaginal intercourse. And then there's oral intercourse, right? Every one of those, there's a risk, right? And we're assuming no condoms here, right? And we can talk about what the risks are. But what we know is if the positive person is on treatment and they're undetectable. Does everybody know what undetectable means? If you do, you're way ahead of me, because undetectable is a mishmash of everything, right? Undetectable refers to...
Go ahead.
It refers to the viral load, right? The viral load is how much virus is running around in every milliliter of blood, right? And over the years, the tests have gotten better and better and better. And so a bunch of years ago, undetectable meant less than 400 copies per milliliter of blood, copies of the virus. Think of Xerox copies, right? Then the test got better, and it became 75. So if you were less than 75, you were undetectable. Then it became 50. So if you're less than 50, you're undetectable. Now a lot of the commercial tests that you can get in a lab go down to 20. So less than 20 is undetectable. So it's a moving target. And if you go to a research lab, they can go down to something that they love to call, I love this, they call it SCA. You know what SCA is? Don't be quiet. SCA is the single copy assay. So it goes down to 1. So it goes down to 1 copy per ml. So the tests are going to keep getting better. So undetectable basically means that your treatment is making the amount of virus in your blood so low that it's below the limits of whatever the test can find. But that's a moving target. So if the positive person is on treatment and undetectable by whatever test you're doing in the moment, the chance of them infecting their partner is whatever it was based on what the sex act was before, reduced by 96%. So another way to say that is somebody who is on treatment is 96% or more less infectious to somebody else than if they themselves were not on treatment. Does that make sense? So what number you started from, and most of the per coital act transmission risks are on the order of between 1 in 1,000 and 1 in 100, depending on what kind of sex we're talking about. This being descending order of risk. So bottoming being the highest risk and oral intercourse being the lowest risk. Okay? Whatever the number is for that sex act that you're doing, you're dropping that risk by 96% or more. Okay? There's one study that everybody loves to cite. It's an observational study, which means it's just looking at people. And it's looking at MSM couples where the positive person is on treatment and undetectable, and presumably they're not having sex with anybody else other than each other. I call that monogamish. And over more than 2 years of follow-up, there have not been any negative partners who got infected. So people like to say, that means it can't happen. I don't know that it means it can't happen. There are all sorts of if, ands, or buts, no pun intended, that could contribute to someone still transmitting to their partner even though they're on treatment and undetectable. If either person has a sexually transmitted infection, that increases the risk. Why? Because if you're positive and you're undetectable and you have an STD, it revs up the amount of virus that's in the genital secretions. If you're negative and you have an STD, it makes your cells more susceptible to the virus, and it also breaks down the lining that is protective, that prevents the virus from getting in. So that's a double whammy. Okay? Now suppose the positive partner is on treatment and undetectable, but then for whatever reason they stopped taking their medicines, or that virus became resistant since the last time they had their blood work checked. Then they're not really undetectable. And here's my personal favorite one. Just because you're undetectable in your blood doesn't mean you're undetectable in your genital tract. 20 to 25% of men will have intermittent little amounts of virus detectable in their seminal fluid and semen, even though they're undetectable in the blood. Can that virus go on to cause a new infection? Nobody knows the answer to that question. But if you do these super sensitive lab tests, you can find it. That makes me a little nervous. So is it impossible for somebody who's positive and on treatment and undetectable to infect their partner? Of course not. It's absolutely possible. Is it likely? Probably not. Is that a license to go out and have unprotected sex? That's like a biblical debate, right? The Swiss government has said pretty clearly, if you're on treatment and undetectable for 6 months, you don't need to use condoms anymore. They have said that. They have gotten bitch slapped by the public health community because of all these other assumptions that go into that lack of transmissibility. And there's, again, been some mathematical modeling done that shows if everybody in the world who was positive and on treatment and undetectable went out and threw the condoms out the window entirely, the rates of new infections across the world would go up by 25%. What's the right thing to counsel somebody about that you're having a conversation with? I don't know. I think it's really unlikely to infect somebody if you're really on treatment and undetectable, but there's no guarantees. And if it really is a monogamous pairing and everybody knows what the situation is and everybody's with their treatment program and no one has an STD, yeah, I think it's vanishingly unlikely you're going to infect someone. But that's a lot of ifs, isn't it? And are you going to take that chance? It's an individual decision.
So, I want to just remind everybody that unprotected and condomless are two different things. And I will reduce Dr. Landowitz's answer here a little bit, because being on PrEP is already protected sex, and that's how we look at this in many, many ways, because, and I may have just caused a deep breath over there, but the reason why we talk about as a protected sex, the question is there any form of safe sex? Is there, exactly, which is no sex. Is there safer sex? Yes. And I think what we need to understand is that this is about how far can I reduce the risk in order to allow myself to get into it, right? So the question is, when my parents were doing their thing on the beach and they didn't use a rubber, they knew the risk exists that my mother could get pregnant. And she did, because I'm here. But they decided that that risk was okay for them. So what we need to learn is not to judge somebody else's judgment, but to make our own decisions. And the question is, am I more afraid of getting gonorrhea, chlamydia, syphilis, or trichomoniasis that I can get through oral sex without a condom? And whoever uses condoms during oral sex, please raise your hand. I'd love to talk to you. I find that fascinating. I tried once. Or am I more afraid of getting a chronic infection that will stay for the rest of my life because there is no cure for it? And I think that that is two different coins to look at that spectrum. With that one. English, German, so complicated. Achtung. So, and as for the point of undetectable, the international standard of what means undetectable is if you are below 50 copies per milliliter. So, undetectable in one way by the meaning of the word can mean that the test can't detect anything. But in general, the most commonly used tests test down to 50 copies per milliliter, which then constitutes undetectability in general. So that's the medical term. And then when people, if anybody in this room knows about the treatment cascade that happens in the United States, I don't know if you want to talk about it, but we also look at how well are we doing in getting people on treatment, because what we just spoke about is if somebody is undetectable and really well on treatment, then the chance of the virus transmitting is so low. Then what does that mean? And the thing is that in the United States, about 25 to 28% only are virally suppressed. So out of 1.2 million people, about a quarter has less than 200 copies per milliliter. That does not mean that they are undetectable. In the United Kingdom, it's 61% that are undetectable. Does that make sense? So the difference is tremendous. And the thing is that by us going out and talking about HIV negatively or making people feel uncomfortable about it, it veers people away from wanting to talk about their status. It veers them away from wanting to talk to their doctor and getting on treatment. So what we need to make sure is that we welcome this to the conversation too. I have never personally zero sorted. I've never decided I want to have sex with you because you're HIV positive. I rather go by, are you crazy? Or are you sane? That's a much better determinant for me. There's the treatment cascade. Yay, thank you. Okay, so that's 1.2 million people. This is so small. Dr. Landowitz, why didn't you draw a larger? So we think
Don't be a size queen.
So there's so we think 1.2 million people in the United States living with HIV. That's what we think it is, because there is an estimate of the number of people. I'm not going to go into how we calculate this because I'm a science nerd, but there's an estimate of the number of people that don't know that have HIV. So obviously we can't measure them because we don't know. So there is 84% about that are detected. So
Diagnosed.
what?
Diagnosed.
Or diagnosed. Then there is about what is this? In care? Oh, see, I skipped in care on mine. So it's somewhere between, I think it's 47. So there's about 47% of the people are actually in care. Then there is about 36 people that are on treatment. And then there's about 25% of the people, 28. In LA, San Francisco, those numbers are higher. But this is the national average. So if we think about this, this is how it goes. So the more we can make this rise, the better. But also what we have is that everybody sleeping with these 75% could potentially contract HIV at a larger risk than if they're undetectable. Does that make sense? Yes? So these people, it's good to have PrEP too, for those that sleep with them. Anyways, that's very confusing. I'm going to overread it.
No, I don't think it's confusing. One other thing I want to add to that is, remember, when you have a couple or somebody who comes to you talking about, should I take PrEP? And they're like, well, my partner's positive and they're on treatment. So, everyone says that they can't transmit to me, so I really don't need PrEP, right? I always take it a little bit with a grain of salt that that's really the only sexual interaction that's happening, right? Because whether or not we like to talk about it, couples are not always monogamous. And sometimes not both partners know that they're not monogamous. Sometimes they do. And so there's always a role for the HIV uninfected person to take charge and control of keeping themselves HIV uninfected. And maybe they know that they're having other partners, and maybe it's actually those partners who are the biggest risk of infecting them, because maybe some of them are positive and don't know it. Maybe some of them are positive and not on treatment. Maybe some of them are lying to them. People do lie. It is a mean, nasty world sometimes. So if someone comes to me asking for PrEP, if it's safe to do so, it's a pretty rare day that I will not offer it to them with a conversation of the risks and benefits.